IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to our All Things Policy podcast. And today we have an interesting conversation lined up in the context of preventive and rehabilitation care. I have with me Malathi, my colleague from Takshashila, who heads the policy school. I also have Dr. Nandan Kumar, who's a guest for today's episode, and he's a practicing physiotherapist specialized in musculo-skeletal and geriatric care. So welcome, Malathi and Nandan.
Thank you very much, Soumya. Hi, Malathi.
Hi, Nandan.
So while we kind of plunge into this topic, this is something that most of us are curious about. I think preventive and rehab care is a big one today, but we're going to dwell into the framework that I usually use in my podcast is the Samaj, Sarkar and the Bazaar components of it. So we'll go first into the macro level of it. So Nandan, can you just take us through a little bit of where the global atmosphere looks like in the geriatric care, and also break it down for us with a little bit of statistics which will help us understand the magnitude of what's coming in the forefront.
What's happening is India at present is in a very growing state of economy. So we are doing very well for ourselves. The main reason for that is almost 65.1% of our population are in the working group. So we have a considerable chunk who are working now. But what we have overlooked is by the year 2036, we are going to peak this, and then there is going to be a gradual fall of the number of working population people. And this will definitely have an impact on the way in which our economy is going to take a turn and how we have to think in policy, especially for the elderly care. See, the US had this baby boomer generation who really worked hard, and now they are having a considerable amount of elderly people. The same thing with Japan, and even Europe has a considerable amount of elderly people who are cared for. The challenges which we have, are we ready to handle the geriatric population which are going to come in about 20 years down the line?
Okay, so when we look at the numbers, it seems like we have a little bit of time to prep up, but it's something we probably need to start working towards already, right? Malathi, you want to step in and...
Yeah. So I do agree with what Nandan is saying, and it's quite scary because it means in another 13 years we're going to be hitting that mark, right? So which means we need, as the government, measures should be put in place now so that we are better prepared in the decade or the 2 decades that follow. Now, as we all know, seniors need substantially, across these 3 areas. One is financial security. They need help. They need to ensure that they're secure. We know that there's growing medical, expenses, which means that the healthcare, as they age, there's going to be more expenses, which means that even the geriatric and other areas should be looked into. Currently, we don't focus much on that. And of course, seniors do need a good support system. Now with nuclear families, and we are no longer, we're moving out of the joint family system. That is something we also need to think about, because as seniors, it's important that they have a sense of belonging, they live with that dignity, and having this sort of ecosystem and ensuring that, we have that system in place, in the decades to come, and even the community can then support the elderly within, and not think of them as, a liability. Something I think that's very important for all of us to think about now.
See, at present, what is happening is government is spending a lot of money on healthcare, especially in women and child development, providing vaccination for the children, making sure that safe deliveries happen, decreasing women mortality rate in hospitals. And plenty of healthcare facilities are being opened by the government to provide primary healthcare and also secondary and tertiary healthcare for a growing number of population. but there is no dedicated system in place to specifically cater for the elderly, especially in the scenario of healthcare, because elderly people require a little different approach. It's not like one size fits all. Elderly people require more like a psychological support, a support for assisted living, and as you just said about financial support. So you can't charge the same amount of money what you would charge for a surgery for an elderly person and a young person as the same, because obviously the affordability also will be less. So you need to have dedicated healthcare facilities for elderly to take it forward. And it's high time that the government starts framing policies specifically to cater to such population in the near future.
Yeah.
Okay. So if you're looking at it as something that the community also can step in for, can you talk about, in your own experience, if you have seen some things work, and is it too expensive for somebody to opt in? Like we have spoken in the past in another episode for elderly care on certain things like Nightingale and Silver Talkies doing certain initiatives which keep people equipped both at the cognitive level and keeping themselves fit. But that is for people who are more privileged, I would say, because there's a cost component to it. So are there other things that a community at large should step in for?
Yes, in the community level, I think we need to start working on getting the resident welfare associations together, and the local corporator and the local MLA should be able to, earmark certain spaces for providing recreational facilities for the elderly, and also provide basic health services like simple like blood tests, urine tests, and general health checkup. And they should also be able to provide a certain form of psychological support also, because not elderly not only require healthcare but also some form of community assisted living care at the local level. Identify elderly people, have a place where the family members can drop the elderly people over there, keep them from morning to evening till the family members come back from work, and then pick them up and bring them home, rather than a full-fledged assisted living where they are cared for from morning to evening by either a caretaker or in a nursing home. So the community can identify and earmark such places, and this will definitely help go a long way in making elderly care's life much better.
Yeah, I agree with that, Nandan. In fact, compared to the urban, the rural sector or the rural areas, where there's a higher population of India that India resides in, I think we need to keep in mind that in the rural, it's more, there's not that much of a system in place in terms of a formal system in place where, you have these separate kind of setups, right? There, it's a more of a natural transition as you age, as far as you can kind of contribute, and much of our rural is the agrarian society, right? And in that sector, so as long as you can physically contribute, it's fine. But then as you age, many times, because of the economic situation also of the family, they're kind of caring for small younger children, and then they don't have much to go around. It's just they just tend to slowly fade away in a way, right? So I think the governments too should think about this, not just from the urban but also from the rural perspective, and see what they can put into place that's feasible across these different socioeconomic strata.
I agree with you, Malti. There is hardly any facility in the rural area. I, being a practicing physiotherapist, there are hardly any, and I cater to a lot of elderly people, but I practice in a city. But in a rural area, access to rehabilitation care or a rehabilitation center is almost non-existent. Probably the money is not good, or people have not opened up to an opportunity which is available. But yeah, unfortunately, it's very poor.
Okay. But do you think the market is thriving in this space, right? If you look at, say, home medical care services or the kind of equipments that allow people to kind of, be more comfortable with that phase of life, there's lots happening, right, Nandan? So can you talk about certain things that have probably helped people cope well because of these things? And is there, like you said, more modest ways in which not so privileged people also can access it? Or I still remember, I think in the clinic, at some point you had stuff that people can, reuse, right? If somebody finishes a phase of recovery, they kind of give it to the next person. So are there such initiatives that are useful for people to know?
Yes, presently the market is slowly opening up, and it's more so in the urban center. By the use of technology, what's happening is, I'll give you a simple example. An elderly person who has suffered a fracture of the hip, he will be using a walker for a couple of days. So after about 10 or 15 days, he doesn't know what to do with the walker. So he needs to, a walker is an expensive piece of equipment. So he wants to, rent it out to somebody, or he wants to give it off to somebody. So now there is an ecosystem which is available where these things are available on rent. That is one. And second, the market is slowly growing up to providing assisted living nursing homes. Some of the hospitals, especially the mid and small sized hospitals, have slowly realized that there is some amount of money in especially handling elderly care, and they are slowly going away from acute care and working towards elderly care. There are some assisted living centers which have gradually come up, but still we are not able to find a right cost balance, how much the elderly person can pay, because most of the time the elderly person has to dip into his retirement savings, and still the cost is high. But over a period of time, I'm confident that with competitions coming along and a lot of other centers opening, we are going to find a level playing field where quite a few such kind of things will happen. Initially, it may happen at the urban area, and probably it will trickle down to the rural sector as well. So we'll need to wait and watch.
Okay. Yeah.
Yeah, I think the bazaar is one of the golden triangle, right? If you look at the Samaj, Sarkar, and bazaar, the bazaar or the markets has definitely one that has responded better. Especially over the last decade, you'll notice that there are many assistive devices that are out in the market, and these devices will help extend a senior's independence, right? Because the seniors we're considering are 60 plus, but the change happens very gradually. The motor skills or the cognitive ability, it's kind of deteriorates very gradually. And they themselves, they would have been independent and very active citizens at one point, and then and they might not even own up to the fact that they're not able to do many of the things that they could do even like in a year ago, right? So it's difficult for them as well. So to ensure that their homes are safe and they're more accessible, there are a number of devices that have come into the market. Like, for example, you have the personal alert system. You have cameras that can be fixed for remote monitoring. There are toilet seat risers. There are grab bars that you can install in bathrooms or at the entrances. You can have ramps to the entrances of your homes. Like the adjustable bed and railings that can be fixed for the bedrooms. Even touch-tone telephones with larger buttons are available now. Speaker or hands-free capabilities are available. You have also things like kitchen tools that make it easier for them to operate, since they're visually too, right? And because of low vision, they might not be able to read. So there are things to assist them in reading, and for them to actually be part of maybe the day-to-day activities and not feel left out. So a bunch of things have come in the market. Of course, it comes with a price, and which is why it's more accessible to the urban areas. But the good thing is that options are there, and the people can avail it. And of course, things like rental options, like you mentioned with the walkers. There are a number of medical setups which kind of actually rent out everything from wheelchairs, because for post-op, many of these equipment just need to be used temporarily, right? So things like that are also available. So that's a good thing. It's a good sign. I think we're moving in the right direction.
Yeah, but I was also curious to understand, while there is insurance component, right, for surgeries and other things, are there enough instances, or rather, how does it work with physiotherapy being in the insurance view? Like, does that get reimbursed, and how tedious is it, or is it something that's ignored?
Physiotherapy and rehabilitation is also covered under insurance. Probably the policy will be a little higher. And unfortunately, coming to insurance, what happens is the younger you are, the insurance premium for healthcare is less. But as you grow older, the premium of health insurance is also more. Two reasons for it. Elderly people coming under the bracket of insurance is also less. So one of the reason for that is that. The second, And elderly people who fall sick will require prolonged hospitalization stay. His recovery will be longer. He may require more complex surgeries. So probably that is another reason why the insurance is also high. But if sizable chunk of the population, especially the elderly people, are covered under insurance, definitely the cost of caring for these elderly people will be less. And physiotherapy and rehabilitation services for such patients also could come under the insurance, and it could also be less to provide. I mean, the cost will be much lesser for them.
Okay, but do you think, in the current scenario, is it compromised because some of these are not covered and somebody can't afford this kind of treatment because no policy supports it?
More than compromised, access to care is limited because they know that they won't be able to afford such care. So accessibility for such a care, even though if it is available, will be difficult for them to get.
Okay, so now we'll take a quick break and then we'll come back with more deep dive questions.
Yeah, one more thing that I missed mentioning is on the bazaar front is about the caregiving agencies that have cropped up right over the last decade or so. Again, this is also because in the urban areas, especially larger towns, tier 1 metros and tier 1s, is that we'll notice that many of the children have left and gone abroad. And so their parents are left to fend for themselves. So their finances are secure, so they're able to kind of ensure that that's taken care of. Which means that, but the only thing is, as they age, they need some support at home, right? Someone younger to help them and give them a hand. So these agencies have now cropped up, and of course, currently we don't have a policy in place as to ensure that these are run with the required, in terms of ensuring that it's not a scam, because we have had cases where agencies kind of charge exorbitant amounts, and the quality of care won't be monitored as such. And then the children are usually abroad, and they have to depend on these agencies to ensure that their parents are taken care of. So I think if policies can be brought into place to kind of ensure that this is kind of done in a, with this more quality care given, that will be good. But the option being there itself is nice. The fact that you could have a registered nurse, a qualified nurse to help with post-op, that you have the option of having a 24/7 person just to help with the day-to-day activities. I think all these things are important because it also kind of ensures that the seniors are feeling independent in terms of managing without their children. But at the same time, they have that support system. If not the immediate family, at least they have someone that they can turn to on a daily basis.
That's good, Malti. I mean, we have a support system to take care of the basic needs of the seniors and help them out in their, journey to recovery. But there's still the psychological impact of being left alone will always be high on their mind. Right. Seniors will long and miss their near and dear ones. Now, with the advent of nuclear families, elderly people are generally left at home alone, and their near and dear ones are not there. Whereas if you just rewind yourself 50 years ago, everybody stays together as a joint family, and somebody or the other, especially the family members, are there to take care of the elderly people, which is lacking now. So this is one thing which we need to look into.
Yeah, I think, this also lends itself to how a lot of women have compromised careers because they end up being primary caregivers. And the fatigue that sets in, we've talked about it in the last episode, but it means that, this at the background, you always have this caution of, oh, I hope this person is fine. And leaving them means you need to check box on multiple safety components to be rest assured at least some things are taken care, right? I mean, it's not easy. Yeah.
I do completely agree that the caregiver fatigue that has kind of now been recognized, and it's not easy, but I think it's important for the caregivers, whether they're family members or otherwise, to actually ask for help, right? Because it's difficult to be doing this day in and day out. So the priority should be that the seniors should be treated with compassion. They should be treated with that kindness and respect, and especially if an elderly in the family has dementia or Alzheimer's, we know it's very difficult to really be able to manage, kind of handling maybe repetitive questions, or kind of having to go over certain instructions over and over again. So we as caregivers, it's important that they do get that break as well. But at the same time, the elderly also feel that they are wanted, that they're living a kind of a dignified life, and that's important too, because if mentally they're not happy, it'll definitely tell on their physical health also.
Yeah. Also, I think from the infrastructure point of view, right? If we look at small changes that can be made to ensure accidents at home are prevented, or just the apathy as a society that we have for senior citizens only shows that we hardly see them around, right? If the pavements are dug up or if there is no access to parks. So what do you have to say about these things?
Infrastructure makes a huge difference, and we should have infrastructure catered to elderly people. For example, if you go to a shopping mall, if an elderly person who is living by himself, a mobile elderly person, he should be given priority parking, which is closer to the entrance of the shopping mall. Or there should be easily access to, using ramps and grab bars near the stairs, and obviously non-slip flooring. All those things are very important, especially to cater to the senior citizens. And also the government should start pitching in and providing certain kind of services at the senior citizens doorstep itself. Any of the government citizens, for example, any bank related services, they should be, it should be more like a rule rather than a part of convenience. It should not be like, okay, we take care of it. It should be like a rule, like anybody above 60, we are going to provide this at home. Many of the government services should be able to be provided at home. A notary signature or a gazetted officer signature or whatever it is, it should be done at home for the elderly rather than asking them to wait in the queue or getting things done.
Yeah, and I just also, that's important. And also another point that maybe was not mentioned earlier, but the fact that the elderly, right, or for that matter, even us, those of us in this current generation, should remember that we need to plan for our retirement. We need to plan for ensuring that our finances are secure, because we in the past, when we were in joint families, sort of a system, we depended on the children to kind of take care of us, take care of our needs, and that everything would go fine. But that's currently, with the increase in expenses, the nuclear family setup, and especially in the urban areas where the cost of living is only growing, it's important that even those in their 30s and 40s start thinking more about their retirement and start saving up for it. This could be taken by the policies, or at least putting some amount aside, and not just completely, letting the future take its course, thinking that my children will take care of me, because at some point in time that might become a burden either way, and it won't be a win-win for sure. Right? So I think the finances aspect is something that people should start thinking about when they're younger itself, to ensure that their retirement and their senior, at that age, that things are taken care of. They're not dependent on people, on others in the family.
Yeah, I think we also need to ensure that people at times have assets maybe, and they don't have it in a liquid format. So, they compromise on treatments because they probably have a property which needs to get sold even for a treatment to happen. And instances are there that they are at an age where it's hard for them to go about the entire, the nitty-gritties of it. They're not confident about interacting with a person who could buy the plot or stuff like that. So they end up thinking that they don't have the money for treatment, whereas they, in literal sense, they do have it, but not in the liquid cash form. So are there, do you also see patients like that, like who probably negotiate on the treatment, not because they can't afford it, but have not thought through it well? And that's why, like Malathi said, the financial stability is a huge component in getting, uncompromised treatment of sorts.
Yes, many a times I've seen in my practice elderly people who have a lot of assets. But what happens is, when this happens, there is always some form of fight within the family. Their near and dear ones would be eyeing that. So they don't realize that this particular asset, which is built by their elderly person, is for his own use. Instead, they think it is as a natural transition. It will be, willed to the children and then their grandchildren, etc. So I think education, that, or removing the emotional attachment to that and using it for our own benefit is what I feel, a senior citizen is lacking. And they should be more aware that they should be able to manage their finances better. They would have managed the finances during their working period of their life, where they would have earned money, bought a property, kept it with them, thinking that at the time of need we will require it. But when the real time of need comes, that is a time when they have to take care of themselves, they are unable to let go. I see a lot of elderly people having that, but they're unable to let go of that property. They feel that they have an emotional connect, and they are very hesitant to sell it and then use it for their own personal benefit.
Yeah.
They don't use that. They don't want to let go of it.
Yeah. And also maybe the decisions that come with medical emergencies, right? Whether a surgery should be done or not, and taking that call, they're not in a cognitive frame of mind where they can apply rational decisions. Right?
Yeah. Because at the same time, at that age, they also feel a little vulnerable. They feel that they are dependent, and all decisions has to be taken by a more their children or their near and dear ones. They will not be in a position to kind of take their own independent decision. This is one of the challenges which I have seen, especially in treating elderly people.
Okay.
Unfortunately, this is only going to grow, right? Now with the aging population, we'll see more of this happening. In fact, that's one of the reasons why things like living will and other things are coming into the picture now. But then, to kind of ensure that there's some advanced directive in the form of a legal document that specifies the type of medical care that an individual does or does not want in the event of something happening. So with the aging, with all of us, with the population aging and more of the 60 plus or the seniors and the super seniors, I mean, we can expect more of such things happening, right, in the future as well. The other thing I just wanted to mention is that the government too has come up with a few schemes. Of course, this is for maybe below poverty level, but one interesting one is the reverse mortgage scheme. So I think those who are sitting on assets, I think this is sort of an innovative program designed for supporting senior citizens, where I think it was introduced back in 2007 by the Indian Ministry of Finance. And it's sort of like a loan scheme that enables senior citizens to mortgage their residential property, and in order to avail themselves of at least of a loan of up to 60% of the house. So that way, they instead of them liquidifying the asset and then managing the amount, right? Here they are in their own property, and then they've kind of mortgaged it out so that they'll be in a better financial situation. There are other schemes, of course, but these are more, predominantly for below poverty line that the government has introduced.
I still feel the awareness of such schemes is still lacking among the elderly people, or they consider it as a taboo. It's also elderly people, when they feel that, okay, we are mortgaging our house, or it's as good as they think that they're selling the house for money. So that mental makeup of how they perceive this scheme may also be different. So more awareness has to be created that this is beneficial for them.
Yes, definitely. Especially because that generation also lived in an era where taking loans was not, was kind of looked down upon, right?
That's right. So I think this should be as a lesson for us, because we are now in the working population. So when we come at the age of 20 or 25 years down the line, this should be a lesson for us to start thinking in these terms.
Yeah. Okay, so I think we had quite a serious conversation without anything that we could share on the lighter note, given the kind of topic we chose to discuss on. But on the serious note, I think let's also end with reassurance that, like you said, we'll probably be the better lot, which is proactively going to think about healthcare and financial stability and how feasible it's going to be to ensure care is given at its optimum, right? And also build an ecosystem that's very supportive as a community, and also be part of what the government policies would look like to ensure we have a better senior citizen life that we'll all lead, right, Malathi?
Right, that's right. Absolutely. Hit the nail on the head, Sonia.
Yes, yeah. Okay, thanks, Nandan. Thanks, Malathi, for being on this conversation.
Thank you. Thanks, Nandan.
Yeah,
Thank you.
it's all right. Yeah, bye-bye.
Bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.